So today's first surgery was on a 76-year-old female who came to us with complete heart block. So what we did is we put a permanent pacemaker that will increase the beating of the heart. So this is the first of its kind cardiac intervention in entire district hospital of Meghalaya. In fact, this patient was very poor. If they go outside, this particular intervention will require around 5 to 6 lakhs. So definitely it's a very satisfying experience. Now basically this is for the good of Garo Hills and especially for Garo people, and even people from Meghalaya, Shillong, they don't have a cath lab in Tura Civil Hospital. They are dependent on Nigrims, and Nigrims is overloaded. Sometimes they have to wait for 3-4 months for one particular intervention. So those patients also can come to Tura Civil Hospital, and we'll try our level best because these are all very highly skilled and very sensitive operations, and it cannot be said that it's 100% without any risk. It has risk of its own. Slowly we'll intervene on children with holes in the heart, that also will close here. So let's hope for the best and go on to the subclavian vein. There's a vein called subclavian vein in the left shoulder. So through that we have passed the leads to the heart, and we have put a generator in the left shoulder. And so the generator will be supplying the current to the heart so that it will keep on beating at a normal pace.